This is Sarah Mikesell with thepigsite.com, and today we're here with Dr. Liz Wagstrom. She is the Chief Veterinarian with the National Pork Producers Council. Thanks for being with us today, Liz.
Thanks for inviting me.
Very good. With the outbreak of African swine fever kind of moving across different parts of the world, can you tell us a little bit about how that movement is occurring?
Sure. African swine fever is transmitted through close contact. So unlike some of the diseases we know that are aerosol and moved great distances, this is close contact, nose to nose. Bodily secretions can transmit it. But another concerning transmission factor is the fact that it can be transmitted through meat. And it can survive for long times in uncooked or even cured meats. So we have reports that it's survived in Serrano hams for over a year. The other thing, of course, that we worry about is once you get a sick animal, how do you diagnose it?
Right.
And so the symptoms of African swine fever can mimic other diseases, whether it's a Salmonella, septicemia, or some of those things we'd see fairly regularly. So it's really important to have your veterinarian on board, make sure that they're sending in the correct samples. Here in the United States, if there's a suspicion that it could be African swine fever, our state or federal veterinary authorities ought to be called in to do a foreign animal disease investigation. And so making sure that they're going to reputable laboratories using validated tests and that the veterinarians are sending in the right samples. In the United States, our samples of choice are spleen, tonsils, whole blood.
Very good. And in other countries, what are you seeing? What kind of diagnostics are you seeing them using?
Right. Well, we understand, obviously Europe has had a lot of experience with doing a great amount of surveillance. And so they're testing wild boar, they're using PCRs. We also know that they are doing some, looking at some antibodies as well as the antigen that you detect with a PCR. So having that robust surveillance, having a lot of tests, being comfortable running those tests is going to be really valuable as you look at controlling an outbreak.
Right, because the tools and being able to, I would just think having the tools available to immediately attack these outbreaks are critical.
Yep, and it's also really critical to have a test that you're comfortable that a positive truly is positive and that a negative truly is negative. So that's really important when you're talking about a disease that has the trade impacts as well as the animal health impacts that African swine fever has.
Yeah, very good. Well, thank you so much for all the information today, Dr. Wagstrom.
Well, thank you.
This is Sarah Mikesell reporting.